The NHS in some parts of the country is using weight and age to decide whether a couple should have fertility treatment or not. That's according to a survey of nearly 200 clinical commissioning groups in England by the campaign group Fertility Fairness. Well, Aileen Feeney is co-chair of Fertility Fairness and joins us from Guildford. And Charlie Samuel-Camps is in our Southampton studio. She's been unable to get an IVF treatment on the NHS. Good morning to you both.
Good morning.
Hi. Aileen Feeney, let's begin with your survey because you found quite striking differences in different parts of the country.
Yes, so that's right. So in terms of a woman's age, the NICE guidelines are very clear that women should be able to access IVF treatment up to the age of 40 and have 3 full rounds. And yet what we're finding, and that's been the case for Charlie, some CCGs are actually limiting it down to the age of 35.
And Charlie Samuel-Camps, you've been trying for some time, haven't you, you and your partner, to have a baby?
Yeah, about 6 years now.
And so what happened when you tried to get IVF treatment on the NHS?
We started previously when I was 34 and now 38, and nothing was mentioned to us about any problems then. I was checked, and so was my husband, and we just told to continue. So we left it, and then the beginning of this year we thought, okay, nothing's happening, so we probably need some extra help. We went to the doctors beginning of the year. They started us, so I had blood tests and semen analysis. And then in September we went to the fertility centre in Southampton at the hospital, and that's where we were told that we don't qualify and because of my age, because I was over 35.
That must have been quite a blow.
Yeah, it was just primarily just a shock to begin with, because nothing had been mentioned, and we'd started this journey, you know, waiting for appointments and everything else. So we'd started it for at least 6-7 months, and then to find it out, it was gutting. Yeah.
How does that fit in, Aileen Feeney, with national guidelines?
So national guidelines, they are very clear, and they state that up to the age of 40, a lady should be entitled to 3 full rounds of IVF. And those NICE guidelines are based both on clinical and financial basis. So
NICE is the National Institute for Health and Care Excellence.
Yeah, absolutely, yes, that's right. Yeah, so those guidelines are set to give the lady the best clinical chance of having a baby, as well as the most financial use of spending the money as well.
But yet these other criteria are creeping in, according to different clinical commissioning groups.
Yeah, that's right. And what we found this year is that some CCGs are also bringing in a man's age and man's BMI into those criteria, which there is no evidence to say that this impacts the chances of success of IVF.
So, Charlie Samuel-Camps, where does this leave you? What are your options now?
Well, it's quite recent. It's just happened in September, so we were going through that all. So we've got not have children. That's an option. But sell our house and move to an area that it does provide us, and we do meet the criteria. Or get into debt, basically get a loan and try and finance it ourselves. But it's not going to happen by one round. So it's 16 plus grand that we'd have to be looking at. So it's not easy. It's not an easy decision. So.
And Aileen Feeney, this is presumably what you're hearing from other couples around the country.
Yeah, that's right. Infertility is an actually devastating disease anyway, and then when people have to take on the financing the IVF themselves, it's just not fair, and it's very cruel.
Now, we did talk to NHS Clinical Commissioners, and they say that unfortunately the NHS doesn't have unlimited resources, and ensuring patients get the best possible care against a backdrop of spiralling demands is one of the biggest issues that they face. Do you have sympathy with that?
Oh, absolutely. Obviously the NHS has got to get their money and use their money to support every disease. But what we believe they should be doing is giving treatment in line with the NICE guidelines, because they've been set to enable them to be financially effective as well as clinically effective.
Aileen Feeney and Charlie Samuel Camps. Thank